This is Dr. Daniel Paul, orthopedic surgeon with EZ Orthopedics, and today I'm going to talk about why I, as a doctor in the United States, don't carry health insurance. If you like this video, we put out new content weekly, so please like and subscribe. So I want to start by saying that I hate health insurance. In my medical practice, I do not take it. I hate it. Everything about it is terrible. It's a borderline scam. But then you might say, well, on the personal note, do you even have health insurance? And I don't. I don't carry it. I haven't had it for years. And since that time, we've had the birth of a baby, and I just had surgery on my elbow. And it's been totally fine without insurance. So how? Well, as I said before, I think health insurance is mostly a scam. You pay tons of premium money, you have deductibles, co-insurances, co-pay, the costs are high. So what I do is for most things that I need, I pay cash, like direct primary care doctor and medications. And you can get these things for significantly less than you would pay if going in the system, sometimes with health insurance. For instance, when I order some medications, I sometimes pay like pennies a pill. So much less than you would pay even if you have health insurance and they charge a copay for the medication. That copay could be more than the medication cost by a factor of a few. And then for larger things, I use a health share. The one I use is Sedera. And basically, it's not regulated, they're not all created equal, but if you find a good one, it will cover you for these surgeries and things, big medical events that you have. For instance, the birth of my daughter, I think I ended up paying nothing, and for my elbow surgery, I think I paid $2,500 for the x-ray, MRIs, physical therapy, surgery, and everything. And basically how it works is to these entities, I'm functionally uninsured. I have to pay cash or get payment plans and float it through, and then I'll actually get paid back by the health share as long as they deem it, they really don't deny much, but as long as you talk about it with them and everything like that, they'll usually pay you back for mostly everything, minus this something called an initial unshareable amount, which is essentially like a deductible. Anyways, the premium for that's a lot less than I'd pay for health insurance. So I pay a lot less for it, and I think it's much better. It can work out of the country anywhere you want. Health share is a good option if you and your family are really healthy and don't rely on a lot of expensive medications. If you are somebody who is like sees a doctor a lot, like goes to the ER a lot, like is on a lot of medications, then health share is probably not a good option for you, and you have to go with health insurance to cover those things. But for most people, and like me, most of my family, knock on wood, is pretty healthy, not too many major things going on, and the health share works fine, paired with a direct primary care doctor who I pay monthly, and my family can see as many times as I want. So I think not only do I get better care this way, I pay a lot less money. So that is why I'm a doctor who does not have health insurance. If you have any questions for me, feel free to leave them in the comments below, and I'll do my best to respond. But I can't give you any medical advice because this video and all my videos are for educational purposes only. Thanks for watching.